My dental problem actually started about 10 to 15 years ago. That's when I started noticing my gums are not feeling right. Every time I brush my teeth, it's always blood and teeth beginning to shake. Obviously, I went to my dentist and he didn't really recommend much. Most of the time I go to him, it's just a bit of this, a bit of that. Have you tried this? Have you tried that? And I realized the only thing he's got for me is we have to remove this today. Next time we have to remove that. I'm not very comfortable with that, and it was getting to me. And I realized this is not the way to go because it was getting personal. And the whole shape of my teeth. I mean, when I was younger, I had a very brilliant set of teeth, gorgeous. And beginning to look funny, and I really didn't like it. It was getting to me, it was getting personal. That's when I decided there must be something else I can do about it. It got to a stage that because I work with the public, I work with the transport industry, and it kind of become very personal to talk to people. I'm being known to talk to a lot of people. I have to explain to a lot of people where they're going, my colleagues, my work colleagues, my governors and everybody. But at the same time, you can't be talking to people and you're conscious, your teeth is looking funny. And it's not because you haven't brushed it several times a day, you have brushed it, but it's beginning to not look right when you look at yourself in the mirror. And when you're talking to people, you think they're staring at your teeth. You're not comfortable with that. You're always trying to talk with a stiff lip and then cover your mouth sometimes. And when everybody's giggling, you don't feel right. You want to have a laugh, but you can't have a laugh. It's just not right. So it kind of got to me. It made me feel not right. And of course, eating and drinking. Obviously, I don't drink alcohol at all. I don't smoke, which is another thing that kind of concerned me because people said maybe because you smoke, maybe because you drink a lot, that's what is affecting your gum, that's what is affecting your teeth. I don't smoke at all. I tried smoking before when I was in school. I was coughing my eyes out, so I stopped it. It never went with me at all. So it's not about smoking or too much sugar. I don't take too much sugar at all. So again, you get to this kind of stage in your life when you want to eat, you are careful what you have to eat because it's not comfortable anymore chewing. Instead of going for steak, you're thinking of, have you got a soft option? Can I have some fish? Can I have some stew? Can I have some soup? You really want to enjoy yourself. You work very hard, but because of the state of your teeth and because of the discomfort you get later on, you're very careful of what you eat. And it's not right. It's not right. I don't think it's the way to go for me. So again, that's another thing that keeps me wondering, there must be something else I can do. And I start searching. You want to talk to people, you want to express yourself sometimes, but you realize you're holding back. You want to probably put your point across to some people, and you don't want to do that because, like I said earlier, they're looking at you, they want to hear what you're talking about, but your mind is telling you they're looking at my funny feet. They're not paying any attention to what I'm saying. Am I getting across to them, or just looking at what's happening to his teeth? Is he bleeding again? Is he got a bleeding gum or something like that? So it becomes very embarrassing in situation, in society, and again, within your family members, you kind of careful, how you talk, how you laugh. Sometimes you have to hold your hand over your mouth just to laugh. It's kind of an embarrassing situation. I mean, people who go through it will tell you it's not very convenient at all. It's not very convenient at all. It's very, very negative. It kind of gives you a negative feeling. You feel, what has happened to me? What have I done to deserve this? And you do everything. I've made all the research I can. I went on internet, I went to friends, I consult doctors, and some people tell you it's probably natural. It comes maybe as you get along in life, and you make all the research you can just to remove it or stop the progression towards where you're going. Teeth falling out, looking funny, not looking right. You try everything. I did anyway. I did until, fortunately, when I started making research about implant. I've done all my research all over the place, and I bought a newspaper, which probably I don't necessarily have to make mention of the name of the newspaper. Opened the middle of the newspaper, I came across Evodental, and everything I've researched about implant, they were talking about it. And the doctor seemed to know exactly what he's talking about. And I can see the before and after picture of some people in there, and the before looked exactly like me. And the after, I was like, if I could look like that, I must give it a go. And that's exactly what I did. When I saw the adverts and I saw the experience, the distance wasn't any problem at all. I came and I spoke to somebody called Steve on the phone, And he was quite understanding. He knew exactly where I was. He knew what I was talking about. And within a matter of days, he said, come for your free consultation. It won't cost you nothing. The doctor will see you. He will pay attention to you. And that's exactly what I did. And when I was there, I saw Dr. VJ. He knew exactly what he was doing. He had the x-ray there, put me in the chair, talked me through exactly even what I didn't know about. And I exactly knew what he was talking about because I've made my research already, and it made me feel comfortable. So it was a good thing that I discovered that solution. I've talked about the free consultation already, and then from there, he said to me, right, where do you want to go from here? And because for the past 3-4 years before now, I've made up my mind. I've been researching about dental implants. I've been comparing their experiences, their practices. And when I came across Evodental, they seemed to know exactly what they want to do, what somebody like me needed. And for somebody who, like me, who doesn't own a mansion, the price they were costing was just right for me. I can afford it. And I agreed. And we took it from there. He gave me some days to come, and I said, listen, I'm ready to do this. And the following week, I was in the chair straight away. So it was quite interesting. After talking to him, I came in like not too sure, because you still know you made all your research, he's done what he's done, he's talking about what he's talking about. But after talking to him and I left that day, it's like I've already done something. It's like something lifted off my chest, because the way he kind of related to me, the experiences he showed me, he's got these clips in his office, and he showed me people who are before and after, some people even worse than my situation. And when I saw the after picture, I was very, very well impressed. I thought he knew exactly what he's talking about. And I left here that day feeling very high. I couldn't even wait for the next appointment date to come back. And that's exactly what I did, rushing back here. On the morning of the surgery, I was looking forward to it. I mean, my whole family was looking forward to it. And it started very early in the morning. They got me ready. All the staff, this is a dedicated center. They know exactly what they're talking about. The receptionist, everybody knew exactly what they're talking about. They know how to handle me. They even told me what kind of breakfast I should have, which kind of helped, just to get me in the right mood. So on the morning of the surgery, I was here early in the morning, fully prepared, made to relax, told exactly, of course, by now I'm fully aware what is going to happen, what I was going to go through that morning. And it wasn't frightening at all. Because if you're doing this kind of a thing for the first time, you're not too sure what it's going to be like. But when I came through it that morning, I was made relaxed. I was told what's going to happen. Matter of hours, it's going to be done. And I did look forward to it. And that's exactly what happened that morning. Then I got to the chair, made fully relaxed. Again, the process started. But it went faster than I thought, because I thought probably it's going to be, we're here now, I don't know how long it's going to take. Already they told me it's just a day, anyway, matter of hours. But when you was in the chair, you're still not too sure. You're thinking maybe they will tell you, you have to sleep here tonight, something's going to go wrong, or something is not adequately right, or maybe your gum is beyond redemption or something like that. But nothing like that happened. I think I was there approximately around 2.5 hours, and that was it. And it wasn't that painful as I thought, because when you think you're getting some of your teeth extracted, and they're going through all these procedures of cleaning the root and everything, getting it ready for the implant, that is at the back of your mind. But when you're actually going through it, when they told you, now you can go to the restroom, you think, when do I come back next? But they said, that's it. You're done for now. And when next time you're here, you'll be walking out with a nice set of teeth. And that was very pleasant, very pleasant. After a few hours, like I said, after about maybe 3 hours, I was called back. And they said to me, now we're ready for you, James, take a seat. And I did. And then the doctor showed me this new set of teeth and said, this is your teeth. And I think, are you sure that is for me? He said, yes, let's have a look. And within 5-10 minutes, put them back in there. And I look at the mirror, and who I saw was me 10 years ago. And it was nice and pleasant. I can't really describe how I felt. I felt very happy. I felt like a load in my chest has just been lifted up. You have to go through it to experience it. I mean, sometimes you're thinking for the biggest words to describe that kind of feeling. When you look at yourself again in the mirror, and what you see was yourself again 10 years ago, it's marvelous. It's a great experience. I kind of look at myself in the mirror and I said to the doctor, thank you very much. And to all the people around him, Liam and all the staff that was around there, I was quite happy because what I saw was pleasant, was right, feels good. And it's not something from the instant, from the moment they put it back there, it just feels like it's part of your body straight away. You can go and drink, you can eat, you can do whatever you want to do with it, and it doesn't feel odd. Maybe it's personal, maybe it's for me, maybe it's because I've been wanting to do it, and it's the right thing for me to do. After the implant, he said to me, James, you can eat anything you want, of course with care because some of the gums are sore. You can drink anything you want. And at the same time, you're thinking, can I really? And as soon as I come down here, I ask for a big box of ice cream, which I haven't had for a long time. Not that I'm a sugar person, but just to push the limit a bit. And I didn't feel no pain. And again, I ordered for dinner, had my steak dinner. And this is me chewing with my own teeth. Of course, they are my own teeth. You can't take that away from me now. It was nice, it was good, and I enjoy every bit of it. 1-day smile procedure, I will not only recommend it for anybody, but if I'm that rich, I will pay for it because I actually know what people are going through. It's not very convenient. I'm telling you, you think some people will tell you it's not terminal illness, it's not life-threatening, but it does affect your mind. It kind of affect your emotion, affect your behavior. It's slow killing in yourself. They look at you, you look the same, but you don't feel the same in your body. So I would definitely recommend it to anybody who is going through the same thing. And anybody who is going through the same thing I've gone through, they will exactly know what I'm talking about. They will know because they have been where they are. And maybe they are where I was before, they will know exactly what I'm talking about. So if they have that opportunity, you can pick up the phone call and go for Evodental. Ask them, it's free. The first time you come around, they will tell you exactly where they can take you from. And like I said earlier, just wish me good luck. If I win the lottery, I'll pay for a lot of people to have the kind of treatment I did because it's changed my life totally. Thanks a lot.